Are you able to see the slides? Clinical side.
This meeting is being recorded.
Clinical side in Focus Academy. So today we will be dealing with dental implants, basically an introduction to the dental implants. Clear? Now, what are dental implants? So what are dental implants? So dental implant, it is an artificial material that has been implanted into the bone so that it can support the prosthesis, dental prosthesis mainly. It can be a crown, it can be a denture, or it can be a maxillofacial prosthesis. Understood? Even dental implants can be used for orthodontic anchorage. Clear? So are you able to follow? Right? So it can be used for a single crown replacement, for multiple teeth missing, and for supporting the denture. So basically, it is made up of titanium. Dental implants are basically made up of titanium. Now, this titanium, when it comes in contact with the bone, it will have an intimate bonding with the implant and the bone. Understood? And this process is known as osseointegration. Clear? So this osseointegration is the reason for the success of dental implants. So upon healing, this bondage will be strong enough to support a denture, sorry, or a crown or a bridge. So it will hold the dental prosthetic in its position. Clear? Now, what are the indications? Obviously, any aduncular space can be an indication for dental implants. So if the morphology of the aduncular space does not support the denture, or if there's no sufficient bone for the denture retention, yes, we can go for an implant supported denture. Patient with poor muscular coordination, so they will not be able to balance the denture, or in such cases we can go for a implant supported denture. Low tolerance of mucosa, that means the patient has less tolerance, or the mucosa of the patient has less tolerance to the occlusal load, so you'll have to go for an implant supported prosthesis. Now, patients with parafunctional habits, which leads to recurrent soreness or instability of the process. Patient with gag reflex, where they cannot adjust to a removable prosthesis. Understood? So these are the indications. Now, patients psychologically who cannot wear a removable prosthesis. And when you go for a FPD or a fixed partial denture, you have unfavorable location or numbers of the abutment teeth. Then we'll have to go for an implant supported prosthesis. Understood? Single tooth loss, where the neighboring tooth has to be preserved, or when the patient says that he or she is not willing for preparation of the abutment teeth, then we'll go for an implant supported prosthesis. So these are the indications for These are the indications for an implant supported prosthesis. Now, what are the contraindications? What are the contraindications? Are you able to follow? Hope you are able to follow, right? So now what are the contraindications? So the contraindication, definitely any acute illness is definitely a contraindication for a surgical procedure. Terminal illness, any patient who is at the terminal stage of his or her life, definitely it's a contraindication. Pregnancy is also a contraindication for implant surgery. Uncontrolled metabolic disorders, they are definitely contraindication. Any radiation treatment over the implant side, definitely it's a contraindication. History of bisphosphonate therapy, definitely it's a chemotherapy, so this is a contraindication. Patient with unrealistic expectation is a contraindication. Improper motivation, patient without motivation, definitely is a contraindication. Lack of operator experience, definitely implant procedure should be done by an experienced hand. Now, unable to restore the teeth prosthodontically. See, the patient doesn't want implant, patient wants a replacement teeth. So if you are not able to provide a prosthetic teeth over the implant, then definitely it is a contraindication. Patient has come to you or will be demanding for a teeth, not an implant. Clear? Now, patient who cannot manage proper oral hygiene. See, these implants need to be maintained properly with proper oral care. If the patient is not able to do so, then it is a contraindication. Now, patients who are hypersensitive or who have allergic reactions to this implant components, then it is a contraindication. Coming to classification of dental implants. Basically, dental implants are classified into three groups: endosseous, subperiosteal, and transosseous. Endosseous, subperiosteal, and transosseal. Now we'll see what are these three different types of dental implants. First one is the transosseous implant. Here the implant is passed through and through the cortex so that it can be screwed over the either sides. That is transosseal. Endosseal implants, they are the commonly used implants. It is placed within the cortex, within the two cortex, that is the buccal or lingual or the buccal or the palatal cortex, so that it remains submerged in the medullary bone. Subperiosteal implant, these are the implants placed just below the periosteum. So the mucoperiosteal flap is raised and placed over the bone. They are the subperiosteal implants. Now, what are the indications for endosseous implants? Yes, endosseous implants are most commonly used if you have sufficient bone support and if you have sufficient width or the height for a primary retention, then you can go for endosseous implants. Ramus frame type of implants or the blade type of implants, when the width and height are being primary concern, when you have buccolingual width, when it is less, then you will go for a blade form of implants. Subperiosteal implants. Subperiosteal implants, they are usually placed over the mandible. They are usually placed over the mandible. It can be placed both in maxilla or mandible. She usually placed over the mandible because when you have an atrophic bone or the ridge is comparatively less to support an endosseous implant, then we'll go for a subperiosteal implant. Understood? Transosseous implants. Transosseous implants are placed only in mandibular anterior region. They are placed only in mandibular anterior region when you don't have sufficient width or height for the primary retention or the primary stability of the implant, endosseous implant. Then we will go for a transosseous implants in mandibular anterior region. It can be used for partially edentulous or completely edentulous patients. Clear? Now, coming to different components of implants. Basically, the implant will have an implant body that is placed into the bone. Then you have an abutment over which you will have the prosthesis. The abutment, it can be an interim abutment or a temporary abutment and a permanent abutment. Temporary abutment where we give a temporary crown, whereas the permanent abutment or the definitive abutment is over which we will give a definitive crown or a prosthesis. So usually what we'll do is we'll place the implant in the bone, then we'll wait for osseointegration. After osseointegration, we will place the abutment over it. Then we'll screw that abutment. Then over the abutment, we will cement or screw the prosthesis. Clear? So that is the basic clinical importance of the different components. Now coming to implant body. So implant body is the main structure of the implant. It can be threaded or non-threaded. So if you have a thread around the implant, then that is a threaded type of root form implant. Non-threaded means there won't be any thread. It will be smooth surface. Understood? Now, based upon the material over the implant body. So the body, it can be made up of titanium, purely titanium, or it can be coated with hydroxyapatite. So that implant titanium screw can be coated with hydroxyapatite. It can be coated with titanium plasma. Titanium plasma means we are spraying titanium particles over the implant so that there is roughness. The surface area will be increased. Then hydroxyapatite coated cylinder type. Understood? Hydroxyapatite coated screw type will be there. Hydroxyapatite coated cylinder will be there. That is hydroxyapatite coated, non-threaded will be there, threaded also will be there. Clear? So basically the main content or main portion of the implant is the implant body, which is placed within the bone during the surgery. Clear? Now coming to different types of root form of implants. Already told you it can be smooth, it can be threaded, that is machine. Textured means it can be coated with plasma, titanium plasma. Then it can be coated with hydroxyapatite. Clear? Second component, it is the healing screw. Healing screw or healing cap or gingival former. All are the synonyms for a same component. Healing screw, healing cap, gingival former. All the words or all the terminology indicate the same thing. After surgery, we place the implant into the bone. Now, after that, you have to get a soft tissue collar around the implant. So after healing, what we do is we raise the flap. After that, we place a healing cap over it and suture the soft tissue around it. Now you will get a gingival collar around the implant. Understood? A soft tissue contouring will be done around the implant. For this purpose, we use healing screw or gingival former or healing cap. Understood? So the healing cap is a component which is used in second stage surgery, that is after osseointegration. so that the gingiva get formed or shaped around the implant. Interim abutment. See, definitely the term itself indicate interim means it is just a temporary abutment so that it can be used for the temporary prosthesis. Understood? Can be used for the temporary prosthesis. Coming to abutment. Abutment, that is the definitive abutment. Definitive abutment is that component that is screwed into the implant which will support the prosthesis. Understood? It can be a cement retained restoration, that is abutment is screwed over which over the abutment we will cement the crown, or we will have to screw the prosthesis into the implant. It can be screw retained or cement retained. Understood? So abutment, it can be screw retained prosthesis or a cement retained prosthesis. The walls of the abutment are usually polished. Length ranges from 1 mm to 10 mm. In non-aesthetic region, this should penetrate into the gingiva at least 1 to 2 mm, so that the prosthesis covers the abutment and it is in a non-noticeable position, so that the patient's soft tissue will mask the abutment. Understood? Coming to impression coping. Impression coping is that component which is used to take impression of an implant prosthesis. Understood? Which is used to take an impression of implant prosthesis. It can be an open tray process or a indirect transfer, or it can be a direct one, pickup type of impression. Clear? It can be an open tray or a closed tray. We'll be discussing which is open tray, which is closed tray in detail in our coming sessions. Now coming to implant analog. What is implant analog? Implant analog is the dummy implant which is placed in our cast. So it is the replacement of the implant in our cast. Understood? So implant analog is the dummy implant or the working model implant in our cast, which will mimic the implant in the same way as in the oral cavity. Clear? Now, wax sleeve. Wax sleeve, it is the portion which is used to cover the abutment. It is used to cover the abutment for a screw retained process. Understood? It is the portion or a sleeve or a plastic sleeve that will be covering our abutment for a screw retain process during the lab procedure. It is something related to lab procedure. Understood? Now coming to process, it can be screw retained. I already told you it can be a screw retained or cement retained. In screw retain, you will have a screw hole within the process. You will have a screw hole within the prosthesis, and through the screw hole you will have to screw the abutment and the prosthesis into the implant. After that, the screw hole is closed with a composite or a restorative material. Can be GIC or a composite. Now basic implant procedure. Stage 1 procedure. Stage 1 procedure is you will have to raise the flap, drill the bone sequentially so that we can get the sufficient width. After that, we will place the implant, then we will suture it. So that is basically the stage 1 procedure. First itself, we will raise the flap, expose the bone, drill the bone to the sufficient width where we need to place the implant. If you are placing a 4 mm implant, we will drill till 3.8. That is sufficient width has to be drilled. After that, we will place a 4 mm implant. 2 mm width will be short. The drill will be slightly less than the implant size so that we will get a primary grip over the bone. Understood? So, before implant placement, we have to ensure that there is sufficient bone quantity and quality. Now, if there is any extraction has to be done, it should be a traumatic extraction. We have to follow socket preservation procedures. Interim prosthesis has to be selected so that there is no movement of adjacent tooth into the edentulous area. Then we'll have to place the implant. Now, during implant placement, we have to prepare the patient. So the patient has to be checked medically. He or she has to be fit. Then patient has to take a oral medication prior the implant surgery so that antibiotic prophylaxis has to be taken so that there is no chance of infection. Now we'll have to raise a soft tissue by putting an incision, then prepare the implant site with implant drills, then placement of implant. Patient preparation, yes, pre-operative antibiotic prophylaxis we will have to give. Then local anesthesia is given. Patient can have a rinse of chlorhexidine mouthwash before the surgery so that you can reduce the microbial count. Coming to soft tissue incision. Incision should be designed in such a way that the maximum access to the residual ridge is obtained for the implant placement. We should try to preserve the maximum quantity of attached gingiva, and also we'll have to preserve the soft tissue for the aesthetics. Understood? Now preparation of the implant site. I already told you we'll have to raise the flap. You can use a surgical guide for implant placement. Then you can drill the ridges with the implant drills. Sequential drilling is done. Maximum atraumatic preparation of the implant site is required so that maximum preservation of the bone is obtained. You can use copious irrigation with saline so that maximum you can conserve the bone from thermal injury. Expose the bone. You can use a surgical guide for implant positioning. Drill it, sequential drilling. You can drill should be placed at the center of the implant recipient site. Understood? It should be drilled at the center of the implant recipient size. Sequentially, we'll have to increase larger burrs so that required width of the preparation osteotomy site is obtained for the implant placement. Now implant placement is done, and it should have a minimum primary stability so that it can get stable over that particular region. After the implant is placed, a primary closure of the wound is done. Now, what the post-operative care? Post-operative radiograph is taken to know the position of the implant in relation to adjacent structures such as sinus, inferior alveolar canal, or any other implants or the adjacent teeth. Patient should be provided analgesics. Patient should use a chlorhexidine rinse for the next 2 weeks after the surgery so that there is minimal bacterial growth around the implant or the healing site. Patient is evaluated for next 2 to 3 weeks so that the healing takes place uneventfully. Okay, there shouldn't be any source of infection during the healing procedure. Understood? And if patient is wearing any denture, this denture has to be relined with a soft reliner so that there is no injury to the, or there is no stress over the healing implant. Patient can wear a partial denture or a ortho retainer such that there is no stress or load over the soft tissue over the implant site. Coming to the prosthetic stage is done after the osseointegration, that is 3 to 4 months after the implant placement. We will again reopen the flap and remove the cover screw. The cover screw is that component which covers the implant. Gingival former is placed for 1 week. Now gingival healing will take place. After that, after the gingival former will be removed, and abutment will be placed, and over the abutment we will give the prosthesis. So these are the basic idea regarding the implant prosthesis. Clear? Is it clear? Hope the session was useful. If you have any queries, you can ask. See, endosseous implants, that is what we commonly use nowadays. Endosseous implants are implants placed within the bone, understood? The normal implants, what we do. Transosseous implants, what we do is we will insert the implant through the labial or the superior cortex, and we will have an exit through the other side of the cortex. Understood? That is transosseous. Endosseous implants are something which is placed within the implant. The normal implant, what I have discussed now, is endosseous implants, because we commonly do endosseous implants nowadays. Nobody does transosseous implants nowadays or subperiosteal implants. Understood? So the endosseous implants are implants which we commonly use nowadays. Clear? Clear, is it? See, success rate of implants. Basically, success rate of endosseous implants are greater. What is because it is placed within the bone, and we will have a healing period of 3 to 4 months. So osseointegration will take place. Then only we will start with the prosthetic procedure. So success rate of endosseous implants are greater. That is why nowadays we follow endosseous implants. Subperiosteal implants and transosseous implants are not at all practiced nowadays. Understood? Now, again in endosseous implant, there are two types. Two-stage implant and single-stage implant. That is single-piece implant, where the abutment and the implant are in single piece. There is no connection or second connection of implants is not there in single piece. Understood? So among these, again, two-piece implant is having maximum success. Clear? Now, how many implants is needed for a complete denture? See, it depends. There are different classification. You can have from single implant to 6 implants. Understood? Single implant to 6 implants. There is a classification is there. for implant supported complete denture. We'll be discussing in detail in our coming sessions. Okay. So minimum how much is required is depending upon the ridge of the patient, the biting occlusal load of the patient. There are different criteria how many implants has to be placed for a complete denture. Clear? It can be from 1 to 6. Clear? Least preferred is 1 implant, and usually 6 implants is not required for a complete denture because you can directly go for a fixed process in 6 implants. But classification, it is from 1 to 6. Clear? See, prosthetic stage. See, prosthetic stage is stage where we will give prosthesis after the osseointegration. So that is the prosthetic stage. Understood? Now, in prosthetic stage, what first we'll have to do is, again, we'll have to raise the flap again because our implant is inside the flap, right? It is inside the bone. So we'll raise the flap. We will unscrew the cover screw. See, implant will be covered with a cover screw. That covering is removed. Then we will place the healing cap. And now we will suture. Now this gingiva will heal around the healing cap. So you will have a gingival collar around the healing cap. Now we will remove the healing cap. Then impression is taken. After impression, you will get an abutment according to the size of the implant, which is shaped. We will screw the abutment over the implant. Then we will attach the prosthesis over the abutment. It can be a screw retained process or a cement retained process, depending upon the situation or depending upon the type. That is the basic idea. Detailed prosthetic stage explanation, different types of processes are there. Different classification is there. That we'll discuss. Okay. So, threaded and non-threaded indications. See, these are two types basically. Non-threaded implants are not available nowadays. Clear? Non-threaded implants are not available nowadays. Threaded implants are only available nowadays. Understood? Because thread is required for primary stability. Initially, only the companies used to promote non-threaded ones. Understood? Nowadays, we have only threaded ones. We don't have non-threaded ones. Now, indication-wise, there is no particular indication as such. Now, there is smooth surface and rough surface still available in the market. Smooth surface is used for implants which are placed over the zygoma, pterygoid everywhere, or single piece basal implants. They are smooth surface. We'll have a discussion. I've told you, without any surface coating, that is smooth surface. With surface coating, that is the rough surface implants. So nowadays we will use only threaded implants. Non-threaded implants are not there. So don't worry about the indication and contraindication of threaded and non-threaded. Okay. Hope this session was useful. If you have any queries, definitely you are free to ask. So all the best for everyone. Immediate implants. Yes. Immediate implants means implant which are placed immediately after the extraction. So when you extract the teeth, there will be a socket will be there. Into that socket, we are placing the implant. That is immediate implant. Clear? Now, immediate implant is something different from immediate loading. Immediate loading means immediately after the implant placement, we are giving a prosthesis, or we are giving a crown or a prosthesis over it. That is immediate loading implants. Immediate implant means implant that are placed immediately after the extraction. Understood? Clear? socket preservation procedure. See, socket preservation procedure. See, after extraction, definitely our socket will shrink, right? It will shrink. In order to preserve that shrinkage, what we can do is we can put some bone graft into the socket so that the width of the socket or the width of the edentulous ridge and the height of the edentulous ridge will not reduce after the extraction. So that is socket preservation procedure. Understood? Different procedures are the socket preservation techniques. Different procedures are the that we'll discuss. Okay. Prosthetic stage. See, prosthetic stage is the stage. Minimum age. See, it depends upon the region. Usually only after the growth of the mandible and maxilla will place implant. Otherwise, it is going to interfere the growth. Clear? So minimum age is after the growth of maxilla and mandible. So when the growth of maxilla and mandible will be completed is depending upon the puberty of that particular patient, right? So it is not exactly the age, only after the growth of the maxilla and mandible has stopped, we'll place the implant. Now prosthetic stage, again you want prosthetic stage, again it is the stage where we give prosthesis. It is done after 3 to 4 months, that is after osseointegration. After osseointegration, what we'll do, we'll raise the flap again, we'll put the healing gap first. After 1 week, gingiva around the healing gap will be healed. Then we'll go for the impression procedure. Impression. After impression, we'll place the abutment. Abutment, over the abutment, we will put the prosthesis. Okay. So, hope it was useful to you all. Study well. If you have any queries, please be free to ask any doubts. All the best. Okay.